Uh, Anti-epileptics or anti-seizure medications. These are a group of meds with different mechanisms of actions and different functions. There's Depakote, Tegretol, Trileptal, Lamictal is the one that you may have come across with some of your patients. Neurontin, Lyrica, and Topamax. So in terms of their mechanism of action, I have some details in the table below, which I would not want to go to. That's just FYI. But in general, what these medications do is that they decrease neuronal activity through their impact on the sodium and calcium channels, and also GABA inhibitory pathways. So they they usually bind to these ion channels, sodium and calcium, and also GABA receptors, and they decrease the neuronal transduction. That's how they help with seizure, because in seizure, we have a significantly increased neuronal activation in the brain. Basically, brain cells are firing nonstop, right? So these medications decrease that, and they stop seizure, or they prevent seizures. So indications, they are FDA approved in bipolar disorder for the mania phase or mixed symptoms, or in the maintenance phase to prevent depression or mania episodes. They are used, all of them are used in epilepsy. Some of them are used for migraine prophylaxis. Gabapentin is used for trigeminal neuralgia, which is a specific type of facial pain. Some of them are used in post-herpetic neuralgia, neuropathic pains, and also fibromyalgia. So we may have had probably many patients who gabapentin is a very common medication in many of psychiatric patients, usually being used for anxiety and pain. Off-label, they are used. Lamictal is used in bipolar depression, not other medications in this group, but just Lamictal. In treatment-resistant depression, they are good medications for impulsivity and aggression. Sometimes we use one of them, Depakote, in agitation even. They can be helpful with mood regulation in schizoaffective disorder. Gabapentin and pregabalin are frequently used, prescribed in anxiety disorders. In alcohol, to help with alcohol withdrawal, gabapentin is a prescribed medication frequently. Similarly with alcohol and cocaine dependence, to help with, decreasing the intake. In obesity, Topamax is a medication that is used for weight loss. In sleep disturbances, sometimes we use them. Restless leg syndrome, gabapentin can be helpful, and in diabetic neuropathy and emotion dysregulation also. Considerations with this anti-seizure medication. So their efficacy, depending on the symptom domain of target, is immediate to days. It's different. So, and they can be helpful with agitation, severe anxiety, insomnia, irritability, elevated mood, or low mood even. Side effects, some of them show up immediately, some of them takes days to weeks. Sedation is usually the case. Some of them may cause weight gain, except Topamax, which helps with weight loss. Tremor, increased liver enzymes, transaminitis, decreased serum sodium levels or hyponatremia. Some of them may cause abdominal discomfort. Lamictal may cause rash. And these medications frequently have interaction with other medications. They can impact the serum level of other medications, either decrease them or increase them, which is a consideration when we are prescribing any of these medications. In terms of workup, we would want to avoid some of them in pregnancy because they can cause anomalies. We usually check the liver function tests. We usually check the white blood cells, do the CBC. We check the serum electrolytes. We do weight monitoring. And for some of them, we check their serum drug level, like Depakote, because they have a therapeutic window that they need to be in certain serum level to be effective.